Hello everyone, it's Mark Taylor here from Patient-Led Oncology. As you'll have noticed, it's a video today. One of the things we've started to realize in doing our posts in written form is the complexity of the world of integrative oncology as we see it has got too complex for a short few hundred word article, and it doesn't allow us to reflect the color at which we see things. What we'll start to do is videos to explain things. And what we wanted to talk about today is testing, and testing really at the highest level of integrative oncology as we see it. We have a lot of people come to us for queries about what tests to do, and a lot of doctors have their priorities, or doctors have relationships with certain companies who stick with one company. And our observation from looking at lots of different tests that people are doing is there isn't really a best. It's a question of what's right for you. Some of the more mass market ones, RGCC and Data, do a lot for the money as a very quick way of testing things. It's not a bad thing. But the area we focus on is on the frontiers of integral oncology and helping doctors find creative solutions at this top end. And what I wanted to talk today about is an approach that some of the more sophisticated doctors are using to help establish what drugs to give. The tests are not particularly cheap, so this is not for your mainstream, but it gives you an indication as to what can be done, and people can understand within this framework how they can utilize some of these tests for their benefit. We are going to walk through two tests. One is the next-gen expression profiler. And what that is next-generation sequencing on the tumor from a biopsy. And their approach is they help open the doors for any integrative option that they can find that correlates with the genetics of your cancer. It's a very complex report, so you get 130 pages when it comes through. It's quite overwhelming for patients and for doctors. And we help some doctors translate the data by saving time for them. But what it does do is it looks at probably over 1,000 different medications against your tumor and gives a suggestion of what will work or what will not. And it acts as a great filtering tool for filtering out things that are unlikely to be effective. I'm just going to flick through some of the results here. So this is a patient who's happy for us to share her information, which is a colorectal patient we're working with right now. And these are theoretical sensitivities of various drugs. I'm trying to highlight this one here, this Topotecan, considered intermediate sensitivity to sensitive. And then it's not chemotherapy drugs that are done. So this is an example where Ivermectin was looked at, yellow suggesting intermediate sensitivity. This is a common one. A lot of people now starting to use Ivermectin. We need to work out what tests can be effective to establish whether it's going to be useful or not. With natural supplements, you can look at here. This one indicates on when looking at trail, Quercetin seems to be highly effective. And then this is probably one of the most underutilized and untalked about approaches in integrative oncology that we believe is used today. And what this does is it looks at the gene expression of your tumor and matches that to potential TKIs that can work not on the driving mutation, which is typically how TKIs are used in standard of care oncology, but looking at how certainly the multi-targeted TKIs work on overexpressed genes that are leading to resistance proliferation within your tumor. So what it does here is they've looked at all the TKIs, they're looking at the overexpressed genes from the tumor, and the darker the color, the more overexpressed and the more likely this drug will have some impact on it. In this one here, we've got FGFR3 very highly expressed, SRC highly expressed, and Dasatinib we chose for this patient. Now, what research is also starting to suggest is that lower doses of TKIs can be almost as effective as the full dose, but with much, much lower side effect profile. And they allow for combinations of other drugs to be used in synergy. You can do a search on Perplexity and you can type in TKI dosing and you'll find a lot of research there talking about even 1/6 standard dose. There's some case reports of some great results, depending on the patient. The great thing about using TKIs is there's also some great research to suggest it can help with reducing chemotherapy resistance on the multi-drug resistance pumps. And also it does a huge amount of work on the microenvironment to make the tumor starting to be responsive to immunotherapy. So it's a great treatment to do in combination with checkpoint inhibitors and other methods to get immune recognition in place. Some other things here. I've talked a lot in the group over the past few years about Diflunisal. For those who attended the Yes to Life conference in March, Professor Drev's talked about his results with Diflunisal. So this test gives a theoretical view as to how sensitive it may be based on some genetics. And this is an interesting option for people because it's a totally new option outside of standard of care with relatively low side effect profile, and that has some excellent data in a clinical trial and even some complete responses to pancreatic cancer that are reported. But of course, you don't want to do the treatment if you don't think it's going to work. So this could at least give some indication of a this treatment will work. And then we've got to look at HDAC, which is very highly expressed on this tumor, and gives us an indication that valproic acid should work against this tumor. that's the genetic report. And now we're going to look at the chemosensitivity report. So this is what we've done is we've taken the analysis from the genetic report, and we've specifically chosen the drugs that we from the genetics should be sensitive to do sensitivity tests. This allows us to be way more focused on which drugs and which combinations to test. This is the test here. It's highlighted in the early report on the first page. Topotecan was in the genetic report, seemed to be sensitive, and it was deemed to be sensitive in the sensitivity report. So we found a drug match that wouldn't be part of standard of care for this patient. You can also test natural substances, and as highlighted in the earlier report, Quercetin was considered highly sensitive. Valproic acid was considered highly sensitive, and Diflunisal. We've got synergy already lining up between the two tests, and we have an extra level of confidence going into treatment of which combinations to work with. This is probably a most important part of this test and a very useful tool for us as a community to learn from. What we've done here is take the genetic analysis and also our own research into synergies of various different things to find treatment combinations and sense their effectiveness. What we've done here is combine Artesunate, vitamin C, and Quercetin. There's some good research to suggest if you do Artesunate before vitamin C, you take iron from the blood and you load it into the cancer cell. And there's some other research to say if you load iron up in the cancer cell, it can make the vitamin C up to 300% more effective. And likewise, there's some good research that suggests vitamin C and Quercetin are synergistic. So what we've done here is create a combination treatment at 81% effectiveness, which is even considered more effective than a lot of the chemos. Now, something to note here, when they do these sensitivity tests, they typically leave the cells in the Petri dish for a long period of time, way more than that would be just done from a single IV. So that needs to be caveated, and then thought needs to be put into how to get the bioavailability and duration of these drugs in the system for as long as possible to recreate that effect. The other thing to note is through the groups, everyone's been starting to talk about this Ivermectin, Menben, combination. We were able to test this, and again, what it's looking like is something potentially highly effective, 74%. So, and this is interesting because it's something that's fairly easy to take these drugs throughout the day to kind of keep the blood levels at a cytotoxic amount. So I think this is going to become, I think, a very interesting area of research for everyone. You do need to be very careful watching the liver enzymes. It's very keen to be, or important to be under the guidance of a doctor guiding this. There's some reports if your liver is compromised of liver inflammation spiking, particularly on fenbendazole, and that liver inflammation leading to hyperprogression in a small number of cases. So if doing this, do it under care of a doctor who knows what they're doing, and keep an eye on liver inflammation and the markers, because in some cases you do see a spike. And then this final one was interesting because we're seeing these two quite effective backbones opening up, one with vitamin C combinations and the other one with ivermectin combinations. We wanted to test the synergy between the two, or if they were counteracting, and it looks like they were synergizing to a certain extent. So vitamin C was identified as 43%. And ivermectin is 34%. So in combination, they seem to synergize. So that kind of does mean that you can use these two things in parallel as well. So we hope you found that interesting. There'll be more of these coming up, and our book should be out in about a month. There's so much content on there. We've decided to put it online first. So we'll be updating shortly to give you updates on